Right now, the bacteria are winning the game. They are winning the race, and we are now in catch-up mode. And we now, once again, need to try to get ahead of the bacteria where we have multiple drugs that will be active so that when they mutate and become resistant, we won't be out of options.
The rise of superbugs. Last week, Luke Moretti looked into these nightmare bacteria that are highly drug resistant and potentially deadly. The Centers for Disease Control and Prevention is leading the charge against this growing problem.
And News 4's Luke Moretti is here with more about their plan of attack. Luke?
Yeah, Don and Jackie, the CDC says antibiotic resistance is a, quote, quickly growing, extremely dangerous problem. Could we see a time when surgery and cancer therapies are under threat? Tonight, we hear from a top CDC infectious disease expert who calls this a critical threat to human health. We begin with a simple question. Are we entering a post-antibiotic era?
For some patients, we are already there.
That's the word from Arjun Srinivasan, an infectious disease doctor with the U.S. Centers for Disease Control and Prevention.
There are definitely patients who are hospitalized in the United States for whom we have no antibiotic options.
While it's rare, he says it does happen in the U.S. Last week, we told you about the case of a Nevada woman who died last year from an infection caused by a type of superbug called CRE.
Antibiotic resistance is a critical threat to human health.
How did we get to this point? Part of it involves evolution. Bacteria develop resistance to antibiotics when they're exposed to them. Unfortunately, the development of new antibiotics has slowed.
Bacteria haven't slowed down the rate at which they develop resistance, and so now we have this mismatch where they are developing resistance faster than we're developing new antibiotics.
What's more, he says antibiotics are foundational to modern medicine, things we take for granted, like cancer chemotherapy and organ transplants. They are huge advancements that depend on our ability to treat infections. Imagine a world without effective antibiotics.
We can't do chemotherapy as aggressively as we would like to. Maybe there are patients who can't get organ transplants because of antibiotic resistance. So, this is really a critically important issue.
And he says the problem is far too complex for any one group to address and that it will take everyone working together in a new and unprecedented level of collaboration. We're talking about academics, government agencies, and industry. Luke Moretti, News 4.